Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about syphilitic ulcers. Syphilitic ulcers occur as a result of infection by bacterium called Treponema pallidum. Treponema pallidum enters our body through a variety of ways, for example, through sexual intercourse with the infected person, or through direct contact with the skin lesions of the infected person, or through sharing needles with the infected person, but it can also be transferred from mother to child, that is during pregnancy and childbirth. The sites that are commonly affected by the syphilitic ulcers include the private parts, the anal region, the mouth, the lips, the palate, but you can also find this ulcer on the breasts and the superficial bones, for example, the sternum, the tibia, and the skull. The clinical presentation of syphilitic ulcers comes in stages. We have the primary syphilis, secondary syphilis, latent syphilis, and then the tertiary syphilis. The primary syphilis usually presents with an ulcer called a primary chancre. A primary chancre is just a single ulcer that is painless, usually at the site where the bacteria first entered the body. For example, the private parts of the patient, the anal region, the mouth. And this ulcer is painless, like I've told you. When you touch it, it is going to be hard. And the edge of the ulcer is usually raised, and the floor has a lot of fluid, usually containing the bacteria. And this fluid is very infectious. When you get into contact with this fluid, you can easily get infected. And at this stage, the patient is highly infectious. So I urge you that if you see any lesion on your body of that caliber, especially in your private parts, please don't have sexual intercourse with your partner. First get treatment and let them also be treated, because majority of the time we treat them when the partner had that lesion. And of course, during that time, please practice safe sexual intercourse. Use condoms such that your partner is not infected. And of course, please come to the hospital, because if you don't come to the hospital, that lesion is going to heal. And when it heals, it doesn't mean that you have healed from the syphilis. It means that the syphilis can easily transition to another stage. And the more the syphilis is left to transition to other stages, the higher the chances of damage to your organs. By the way, the lesion that I'm telling you about usually comes about in the 4th week post-exposure, after you have been exposed to a person that had syphilis. And around 5 weeks after it has appeared, it disappears. And to emphasize, don't be complacent that this ulcer has healed and there's nothing underlying. Majority of the time it is syphilis that is underlying. Please show up at the hospital. You can also have enlargement of the lymph nodes, for example, the inguinal lymph nodes. You can have enlargement of the lymph nodes of the neck and also the armpits. After about 1 month, when the ulcer has disappeared, we are going to transition to another stage. That is the secondary stage, secondary syphilis. And during this stage, the bacteria is now in the bloodstream. And the patient is going to present with a generalized rash. But majority of the time, 90% of the time, this rash is in the palms and the soles of the feet. And this rash is usually reddish brown. So please, if you see a rash on your body of that caliber, it is reddish brown and the lymph nodes are enlarged, it can point to a possibility of syphilis. Please show up to the hospital so you can be investigated and treated on time. You're also going to have another lesion called the condyloma lata during this stage. It is a cauliflower-like lesion, usually in your private parts and also the anal region. If you see such a lesion on your body, it is a possibility that you have syphilis. Please come to the hospital for investigations and treatment. During this stage, you're going to have a lesion called a snail track ulcer. It is called a snail track ulcer because it looks like the tracks that the snails leave on the ground as they are moving around. So look out for a lesion that is thickened and whitish in color, usually on the mucous membrane, for example, the lips and the mouth, inside the mouth. Please look out for that. During the secondary stage, when you have the rashes, you have the condyloma lata, it is a very contagious state. So please make sure that you show up to the hospital such that you don't transmit this infection to your partner. And of course, you have to make sure that you practice safe sex such that you don't transmit the infection to your partner. After about 20 years and you have not sought medical attention, we are going to transition to the last stage, which is the tertiary syphilis. During this stage, you're going to have damage to your organs, for example, your heart, your blood vessels, your spinal cord, your brain, your joints, your liver, your eyes. Although the infection can be cured, but the damage might be irreversible. The damage to the organs might be irreversible. The individuals that are at risk of syphilitic ulcers include sexual workers, people that live in areas that have a high prevalence for syphilis, people that abuse intravenous drugs, people that have multiple sexual partners, and a low socioeconomic status. The investigations that we carry out in syphilitic ulcers include a dark field microscopy. We also do RPR, VDRL, and these tests are usually confirmed by the fluorescent troponemal antibody absorption test, as well as the troponemal pallidum heme agglutination test. We can also look out for complications, for example, complications that have occurred to the brain. We can do a cerebrospinal fluid analysis, where we look at the cells, the cell count, and also the proteins, the amount of proteins in the cerebrospinal fluid. And we can also do VDRL on the cerebrospinal fluid. We can also do a chest X-ray looking out for enlargement of the aorta. We can also do angiogram to look at the blood vessels, the arteries, if they have been affected by syphilis. When it comes to the treatment, the drugs that have shown to work include the penicillins, and people that are sensitive to the penicillins, we always give doxycycline. Those two drugs have shown to work when it comes to syphilitic ulcers or syphilis. When it comes to the prevention of syphilitic ulcers, we always recommend that please exercise discipline and responsibility when it comes to your sexual life. And this entails having one sexual partner, being faithful to your sexual partner, and using condoms correctly and consistently. Please also show up to the hospital when you get any ulcers on your body that I have detailed about, such that we always investigate you, establish a diagnosis, and we initiate treatment such that you don't get the complications that occur in the different organs. Also, avoid getting into contact with human fluid, for example, blood, fluids from maybe skin lesions. And for the health workers, please always use gloves whenever you're in contact with the patient. Please always use gloves. For the pregnant mothers, please, we recommend that you show up to the hospital for antenatal care, such that we can take a test. We can do a screening test for syphilis on the first visit, then in the third trimester, and also at delivery, such that if you have any syphilis going on, we can always treat you so that we can avoid transmission to your child. And of course, avoid abusing drugs, especially intravenous drugs, because it can predispose you to syphilis. And also avoid sharing needles. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.